The open enrollment period closes today for Medicare as seniors across the country choose what healthcare options they think they'll need for 2023. So we invited Eileen Bradshaw, President and CEO of Life Senior Services, to talk about what to do if you haven't finished up making those elections yet. Good morning, Eileen.
Good morning.
So if I'm a senior citizen today and I'm like, okay, I haven't done my elections for my Medicare, they can contact you today. You aren't doing in person, but they can contact you if they have questions.
This is the final day for Medicare open enrollment. So yes, if you haven't had the opportunity to sit down and compare, even though we can't sit down with you today, we could answer a question on the phone. But I'm urging everyone to take a moment, take a half hour really, and look at that plan, because changing might save you quite a bit of money.
What's the easiest way that people can do that to make these elections and get in time for the open enrollment to get their health care covered for next year?
They can go online. There's a plan finder. They can look at various providers, insurance providers. They almost all have supplemental coverage, and that really they can get on and really compare, because depending on what drugs you might have to take, Part D is where the savings really hops in. This is where people are saving literally thousands of dollars by making a plan change. So you need to see what plans cover the drugs that you specifically are on. And it becomes pretty apparent. You can look at each plan and you'll see, okay, this one works for me, this one not so much.
Right, so I put together a basic graphic based on Medicare.gov of kind of what Medicare all covers, just some of the services. Obviously we can't do everything, but we're talking about Part A, Part B, Part D. So we have to know what we want to do. I mean, we're talking about Part A. This is hospice, this is skilled nursing,
so
inpatient.
Part D is where it's kind of what's closing today. There is a open enrollment that starts January 15th through March 31st. So if you are on a plan, whether it's traditional Medicare or an Advantage plan, and you're not happy with it, you can call your provider. You can make a change during that open enrollment period too. So and that's for the Part A and the Part C. So, you know, that gives you a chance to really look at the hospitalization piece, the doctor's office piece. The pharmacy piece is what's really wrapping up today.
Okay, so the pharmacy, the Part D is what's wrapping up today. Tell me those dates again for January. If we didn't
January
get the
15th through March 31st. And Medicare is something that is exciting when people become eligible. People are ready for it, but it's not as simple as we might assume. So Life Senior Services puts on Medicare 101 4 times a year. So if you know you're going to be able to transition to Medicare, you know, go to lifeseniorservices.org. I really urge you to attend Medicare 101. It's completely free, but it helps you navigate the enrollment process and all of the things that you've got in your graphic. You know, we can help you negotiate and make sure that when that day comes, that you're getting the best value.
As people are sitting down at their computers maybe today, again, if it's last minute and they're looking at what they can do, what is typically the #1 question that you will get about Medicare? Maybe seniors who are doing it for the first time or are looking to make big changes to things that they've had in the past. What are some of the big questions that you all get?
Well, there's a lot of marketing around, you know, Joe Namath is on TV talking about Advantage plans. We get a lot of questions about that. How do I get free? They talk about, you know, you may get money added back to your Social Security check. That's in certain zip codes, at certain plans. So we get a lot of questions about that. We get a lot of questions about pharmacy. You know, we saved one woman $48,000 yesterday by changing her Part D pharmacy plan. Drugs are expensive, and they're what are keeping a lot of seniors, you know, alive and active. So it's important they can have the access to them. But $48,000 a year is a huge expense. So we get a lot of questions on how can I afford these medicines? And the right Part D plan is the answer there.
Right, so prescription drugs, again, prescription drugs. Today is your day if you're looking for that. One more thing here, Eileen. So we talk about free health care. This is not free, right? I mean, tell us about the price structures here,
well,
generally.
Right, so I have a very good friend who just became eligible for Medicare, and she's like, I assumed it was going to be free.
Right.
And it's not. It's structured around income and all kinds of things. So that's where that Medicare 101 comes in. It'll really help people to understand, because the cost is going to vary for everyone. It also varies if you get a supplementary plan to help cover with copays and that sort of thing. So to some extent, you can have some impact on how much it costs you by the decisions you make, but it isn't free for most of us. So it's just something to know, because I think a lot of us are just sort of zoom into that day when we can enroll and think it's all taken care of. You have to be an active participant, and you can really shape your experience that way.
Okay, so today Part D, and then coming up in January, you can start making those elections for the Part A.
There is that period where you can make a change, either from Advantage to Advantage plan or Advantage back to traditional Medicare.
Okay, well, Eileen Bradshaw with Senior Life Services, thank you for taking time out of your busy schedule. I know this is a crazy time of year for you all, so we appreciate it.
Thank you for having us, really.